So today I'm going to talk about how to navigate this foot section. I've never really taken that close of a look at it. I'm here at CVS, so let's see what things are going on. There are so many items here, but you could probably get most of your things picked up here, except for this section here. Not the most fantastic, but Dr. Scholl does have a stronghold. Toe spacers, very easily utilized for between the toes for painful hammer toes, bunions. Corn remover pads. You need to be careful with these, especially on the toes. When the medicine is in there, you can see these have salicylic acid within them. The cushions are probably better on the toes. Very popular item, as you can see, is the antifungal items that are found here. Most of these do not work. If you truly have fungus, you will not see much of a result when using these types of things, especially on the nails. So many things here, but none of them quite work very well. Probably prescription strength type of medications, oral medications, or better yet, laser therapy is helpful. For athlete's foot though, for tinea on the skin, the topicals do work very well. And this right here is my favorite. You do not have to pay this much for it. Get the generic. So this is the medication you're looking for. Works just as well. Don't spend the extra money on that. Go generic here, absolutely. Or you can buy it online. These other ones, you know, they're okay, but they're definitely an inferior product. This one right here is going to be the best option. And you've got the sprays. So the sprays themselves are not super helpful. What I will tell you that I do recommend that once things are cured, using some form of antifungal medication to keep things away. You will find that these sprays are okay. You can go either a spray or more natural things like eucalyptus or clotrimazole. But once or twice a month you would spray your foot just to lower the fungal load, prevent infection. Powders tend to be very cakey. They don't do a great job. I do like antiperspirant spray, same stuff you'll find in the deodorant aisle. That will be much more helpful. I'm not seeing it here or any sort of antiperspirant. Make sure it says antiperspirant, not just deodorant. Fungus loves a moist environment and it'll grow very well in it. Plantar wart products. Plantar wart products can be helpful if you catch the wart very early. Typically, something like this. This is one of those times I do like Dr. Scholl's. Most people will say that a Dr. Scholl product does seem to have a better adhesive to it. Ingrown nail reliever. It's probably just a softening agent. Use it for no more than 3 days. If you're still having an issue, come in and see your podiatrist. Let's talk about the insoles. The insoles here are very basic, not overly supportive. Dr. Scholl has done a great job advertising, but not a very great product. Typically will work for about a month, then it stops working, so either keep changing it out or seek a better product. You'll find some options at the bottom of the video. Some things for calluses, these are great. Any of these, whichever one you like the most. Be careful with product that really exfoliates hard, just not to cut yourself. And of course, if you have any nerve issues, diabetes, be careful. These nail clippers are actually pretty good. Ingrown toenail kit, I do like that. I've not known that that exists here. I would use this type of a nail clipper for anybody who's needing to round off their toenails if they're having issues. Be careful with this tool next to it. just be careful with it. If you do end up lifting your nail up to prevent it from being compressed from the ingrown, a good option, put a little bit of cotton underneath the nail and the layer between the nail and the skin. It'll help minimize the discomfort there. And then apply some antibiotic ointment, wipe it with alcohol prior to doing so, just to keep it nice and clean. If you run into issues with constant ingrown nails, you want to round the nail off, and you need something like this pointy to help you work.